Hello, this is Dr. Sargisian. Today we will talk about another disorder, in genetic disorder in pediatrics, which will be diabetes mellitus type 1. So these are our topics for this series, and the highlighted topics will be pertaining to this lecture. Diabetes mellitus type 1 is a complex disorder, and complex disorders are those that involve both genetic and environmental factors to develop or to express, and the genetic input will make the individual more susceptible to develop this health problem, but it may or may not develop unless the environmental uh, input happens or some kind of environmental trigger will take place. If the environmental triggers don't occur, the problem may never happen or may never develop. So, a genetic component of this type of disorders may involve more than one gene, and this may not be, all of them may not be identified, and they are very complex. And again, it's depending on environmental factors, they may or may not develop. There are two main complex disorders that may develop in childhood, and it's diabetes mellitus and asthma. And today we will talk about diabetes mellitus. So, diabetes type 1 is an autoimmune, metabolic, endocrine, of course, disorder where the insulin producing cells disappear in pancreas or they destroyed, and the main point of this that the person is not able to synthesize or to make their own insulin to control the blood glucose levels. Of course, as an autoimmune disease, you may notice that there is a great component of inflammation and immune response or exaggerated immune response exists. And what happened, the immune system of the patient doesn't recognize patient's own cells and attacks them as invaders. So while the trigger is needed for this to happen, there is a genetic predisposition. And genetic predisposition to develop this type of autoimmune response towards the pancreatic cells will be leading to development of DM type 1. And this genetic predispositions obviously is inherited. But inheritance is one thing, expression is something else. Again, to express, there is a needed trigger from the environment. The incidence of diabetes will be high in some families compared to general populations, but it doesn't follow specific pattern for single gene environment or single gene inheritance or so-called Mendelian inheritance. Diabetes type 1 is an autoimmune disease, and it will manifest in childhood, sometime very early when the baby is only a few weeks old, but usually it will be when the person is around 10 or more years old, and very young age is relatively rare. So what makes us think and speculate that this is a genetic disorder? Because when you look at it, you see that there was definitely an environmental trigger, such as infection, after which the person developed diabetes type 1. Studies on twins, or not just twins, but monozygotic twins, show that there is a strong genetic relation. So basically, the studies usually show that both twins will have these um, disorders. So susceptibility to diabetes type 1 determined by inheritance of certain human leukocyte antigen genes, and this is all located, these genes are located on chromosome 6. The tissue types that are at increased risk for diabetes are HLA-DR and HLA-DQ tissue types, and these tissue types express on all cell membranes, and this is like a unique product code for you. However, the inheritance of this particular tissue types increases the risk for autoimmune responses, and most people with these tissue types will not, fortunately, develop DM type 1 or any other autoimmune disorder. So, why? We can ask question, why not everyone with tissue types HLA-DR and HLA-DQ develops an autoimmune disorder? And the point is that they all face the risk to develop such a disorder, but again, there is a need for environmental impact to trigger those disorders. So, and usually environmental impact can be traced historically, when the patient had a severe flu or they had an injury, something like that, something unusual, drastic, stressful to the body, and then person may develop such a response. So basically, in these situations, the genetic predisposition will express if environmental factor is present. So environment, like we mentioned, is playing significant role in the expression of this disorder, diabetes type 1, and diabetes type 2 is also an genetically related or genetic disorder, but type 2 is autosomal dominant inherited disorder that requires also genetic contribution for expression. So type 1 and type 2 are not linked genetically. So basically, if person has type 1, they will not have obviously type 2, or patient has type 2, they will not type 1. So the environmental factors, of course, play significant role in type 2 as well. But for instance, in type 2, if person has obesity and unhealthy lifestyle, doesn't exercise, and consumes too many calories, this will not lead to expression of type 1. So it will not be an environmental factor for type 1. However, it will lead to the development type 2, of course, if the patient has the appropriate genetic makeup for it. But back to diabetes type 1, what is the environmental factor that will trigger the type 2? Oh, I'm sorry. What is the environmental factor that will trigger type 1 appearance? So, what has been shown and documented many times, viral infections will be serving as triggers. Viral infections can be uh, uh, something like some infections that person may develop in childhood, such as mumps, rubella, or even influenza. What happened when this trigger happened, autoimmune destruction of pancreatic cells, not just all pancreatic cells, but beta cells will begin. So when the child developed a viral infection, and they will have fever, headache, sore throat, GI distress, and muscle ache. So they will present with just common viral uh, constellation of symptoms. Then a child may recover and present with seemingly good health, but in few weeks child will start appearing thinner and constantly hungry and thirsty. So that's just famous diabetes triad, polyuria, polydipsia, and polyphagia. Okay, so also, of course, the child will be asking to urinate more frequently. So eventually, what happens in this situation when parents notice this, they will see the healthcare provider, and the random glucose checks will reveal the blood glucose in 300s and 400s. Like not just, directly postprandial, but random, not related to the meal. So, so after that, the diagnosis can be made of diabetes mellitus type 1, and basically you can base the diagnosis not on genetic testing, but on symptomatology and regular laboratory workup. Okay. Also, it's possible to say that there will be a family history, some type of relative of the parent, like close relative, like sister, brother, cousin, parent may have diabetes type 1. So there is some genetic component to this. So how the viral infection works in developing a diabetes type 1? When a virus enters the body, of course, virus needs the body or the cell mechanics to reproduce, and the virus using the cell's DNA. So while this happens, the viral proteins start producing, and at this time, the immune system, like white blood cells, especially natural killer cells or CD16 cells, recognize this virus, and the viral proteins coming from the infected cells, and start destroying these cells, or they produce cytoxins, and which destroy these infected cells. And I guess this is all okay, but what happens? Cytotoxicity to certain cells prevents the spread of the virus throughout the organism. But unfortunately, in this case, if the infection is settling in beta cells of the pancreas, then the beta cells can be attacked by the immune system cells. Okay. Um, Unfortunately, when lots of beta cells are infected, then pancreas will be destroyed, pancreatic tissue will be destroyed, and at that time, with addition of inflammation, there will be sequela of fibrosis and necrosis, basically over time. At this time, obviously, pancreas cannot produce insulin anymore, and patients start developing hyperglycemia with all subsequent symptoms, and you will see the classic triad of diabetes. So, uh, so how environmental factors work, other environmental factor. So if someone has genetic susceptibility, and the viral damage happens to the pancreatic cells, that what happens, genetic susceptibility makes the pancreatic cells more vulnerable to viral infection, and which eventually will lead to autoimmune disease. This vulnerability dependent on age, and at earlier age, people with vulnerability or genetic predisposition to this type of infections invading pancreatic cells are more vulnerable. So with age, this window of opportunity for virus may be closing, and even if the infection happens at older age, the person will not develop diabetes type 1. Okay. So another interesting fact that females are affected approximately 4 times more often than males to diabetes type 1 and autoimmune disorders in general, and it's not really well understood how this happens. Autoimmune response may be also related or to allergy to cow's milk, and it's not just autoimmune response but susceptibility to develop diabetes type 1. It can be correlated to allergy to cow's milk, which this allergy is a real true allergy to milk protein, and it's not the lactose intolerance. Lactose intolerance is the absence of lactase, the enzyme needed to digest the lactose sugar in the milk. So people who have diabetes type 1 may have another autoimmune disease or have a first degree relatives with another autoimmune disease. So it seems like that susceptibility or genetic susceptibility to diabetes type 1, it's not simply the expression of diabetes type 1, but overall it's susceptibility to autoimmune disorders. Epigenetics may give an answer to what aids to the development of diabetes type 1, and different things have been suggested, like DNA methylation, histone modification, and microRNA dysregulations. These all are present in diabetes type 1 and may be considered risk factors for disease development. So signs and symptoms of diabetes type 1. I'm sure you all are familiar with this, and I'd like this just to give very brief overview. So this is all related. If diabetes mellitus type 1, if person develop diabetes mellitus type 1, they will have lack of insulin, and because of that, they cannot utilize the glucose correctly. So because of that, person needs the exogenous insulin for the rest of their lives. So initial symptoms, as I said, are related to hyperglycemia, and they are the classic diabetes mellitus triad: polydipsia, polyuria, and polyphagia. Because the blood develops high levels of blood glucose, the high osmolarity triggers thirst. So patient is thirsty and start drinking fluids more and more, and which is a sign of polydipsia, of course, or which is we call polydipsia, and basically person will crave water, or sometimes they will crave carbonated drinks or sodas. So the more water gets into the system, and intestinal or interstitial, I'm sorry, the interstitial fluid comes into vascular space, and basically we're having fluid volume excess, which obviously leads to excessive urination, polyuria. That's fairly simple explanation. And patient also may develop polyphagia or high appetite, and this is somewhat paradoxical because there is a high blood glucose level all the time. However, because of lack of insulin, very little glucose enters the cell. So patient feels hungry all the time and tired, and because of that they eat a lot, but they won't gain weight. In fact, they lose weight because the calories are not well utilized. And the patient will continue to develop fatigue and ahedonia, which means like lack of interest in pleasurable activities or their usual activities. And if it continues, they will start using fat for cellular fuel. Okay, when the fat is used, then burning the fat leads to development of ketone bodies. Of course, they are acidic, and then patient may eventually develop diabetic ketoacidosis. And you all know that ketoacidosis is a life-threatening condition, and that will require very diligent insulin therapy in inpatient setting and very diligent fluid resuscitation for this patient. Okay, so in here you can see the organ damage or the disorders that can appear like sequelae of diabetes type 1, and there are many different disorders, and the majority of them related to endothelial damage, and you see that patient is more susceptible for coronary artery disease, also peripheral neuropathies, poor wound healing, gastroparesis, and uh, kidney functions will be impaired, and so on. And really, all this comes from excess of blood glucose, which can be damaging to endothelial lining in vessels, and as well as damaging to neurons. So a patient will develop the disorders related to nerves, such as gastroparesis, inability to move the food through digestive canal, or neuropathies, inability to feel basically, or have paresthesias in extremities and like in toes and fingers and so on. Things like erectile dysfunction, also related to nerves, and bladder atony and so on. So the consequences of diabetes mellitus type 1 and type 2 are very serious, and the tight glucose control is imperative to maintain and or avoid, best case scenario, these complications. So like I said, when person developing diabetes type 1, they cannot produce their own insulin, and oral diabetes medications or the newer preparations like SGLT2 preparations, they are not really effective because there is no insulin and no pancreatic function to support or to encourage. That's why the only treatment so far is the administration of exogenous insulin. So because the effects of long-term hyperglycemia are so dramatic and can affect the vascular lining and can lead to all other disorder we just previously talked, that's why we need to proceed with insulin administration and management of hyperglycemia as soon as possible. So the research shows over and over that tight glycemic control has many benefits for patients with diabetes type 1 and type 2. And I apologize bringing the type 2 into this conversation. However, the sequela or end organ damage is the same in both types of diabetes. That's why it's important to emphasize that tight glycemic control will be beneficial for both situations. Diabetes by itself, it's not a deadly disease, but that said, it can cause deadly organ damage, such as cardiac issues, cardiovascular issues, and renal failure. So again, the key is maintaining good glycemic control, and that will lead to longevity and good quality of life.